The racist patient demanded a different doctor. He said he refused to be treated by someone like her. But when his heart stopped beating and she was the only one who could save him, everything changed. Stay with me, because what happened next will leave you speechless. Before we dive into this incredible story, make sure to hit that like button, subscribe to the channel, and tell me in the comments where you're watching from. This story will challenge how you think about prejudice, compassion, and what it truly means to do the right thing when everything inside you wants to walk away. Dr. Maya Carter had known from the age of 7 that she wanted to be a doctor. Growing up in a working-class neighborhood on the south side of Chicago, she had watched her grandmother struggle with diabetes, had seen how the quality of medical care could vary dramatically depending on the color of your skin and the size of your bank account. She had made a promise to herself that she would become the kind of doctor her grandmother deserved but never had access to. A doctor who saw patients as human beings first, everything else second. The path to that goal had been anything but easy. Maya was brilliant, graduating at the top of her high school class, earning a full scholarship to Northwestern University, then fighting her way through medical school at Johns Hopkins. But intelligence and hard work weren't always enough. She had faced professors who questioned whether she truly belonged there, fellow students who assumed she was only admitted because of affirmative action, and a medical establishment that still, even in the 21st century, operated with unconscious biases that affected everything from diagnosis to treatment. But Maya persevered. She completed her residency in emergency medicine at Cook County Hospital, one of the busiest trauma centers in Chicago. Emergency medicine suited her perfectly. It was fast-paced, high stakes, and required quick thinking and steady hands. There was no time for prejudice in the ER, when someone's life hung in the balance. Or at least, that's what Maya had believed. At 32 years old, Dr. Maya Carter was now an attending physician at Mercy General Hospital, a large facility that served a diverse population in downtown Chicago. She was respected by her colleagues, loved by her patients, and known for her ability to remain calm under pressure. Her dark skin, her natural hair pulled back in professional twists, and her confident bearing sometimes made people underestimate her at first glance. But the moment she started working, the moment her hands moved with practiced precision, and her voice took on the authoritative tone of someone who knew exactly what needed to be done, all doubts disappeared. Most of the time, the shift started normally enough. Maya arrived at the hospital at 6 in the morning for her 12-hour shift in the emergency department. She grabbed coffee from the break room, reviewed the overnight cases with the departing physician, and prepared herself mentally for whatever chaos the day might bring. In emergency medicine, you never knew what would come through those doors. Car accidents, heart attacks, drug overdoses, violent assaults, every human tragedy eventually found its way to the ER. By 9 o'clock, the department was already buzzing with activity. Maya had treated a child with a broken arm, a college student with alcohol poisoning, and an elderly woman experiencing chest pain. She moved efficiently between exam rooms, her mind constantly processing information, making diagnoses, ordering tests, providing treatment. Then Robert Mitchell arrived. Robert Mitchell was 63 years old, a retired construction worker from a predominantly white neighborhood on the north side. He had been experiencing chest pain for several hours before his wife finally convinced him to come to the hospital. Men like Robert, Maya knew from experience, often delayed seeking medical care, convinced that toughness meant suffering in silence. By the time they showed up in the ER, minor problems had often become major crises. The triage nurse, an experienced woman named Sandra, quickly assessed Robert's symptoms and flagged him as potentially serious. Chest pain, shortness of breath, sweating, nausea. All classic signs of a possible heart attack. Sandra assigned him to exam room 4 and paged Dr. Carter, who was the attending physician on duty. Maya grabbed Robert's chart and headed toward exam room 4, mentally preparing for what was likely going to be a cardiac case. She pushed open the door with her usual professional confidence, ready to save a life if that's what the situation required. "Mr. Mitchell, I'm Dr. Carter. I understand you're experiencing chest pain. Can you tell me when it started?" Robert Mitchell looked up from the exam table where he sat with his wife beside him. His face was pale and covered with sweat, his breathing labored. But the moment his eyes focused on Maya, his expression changed from pain to something else entirely. Disgust, anger, rejection. No, Robert said, his voice weak but venomous. I want a different doctor. Maya had encountered this before, though not often. She kept her expression neutral, professional. Mr. Mitchell, I understand you may have preferences, but I'm the attending physician on duty right now, and your symptoms suggest you may be experiencing a cardiac event. We need to act quickly. I said I want a different doctor, Robert repeated, his voice stronger now despite his obvious distress. I'm not being treated by someone like you. The words hung in the air like poison. Robert's wife, a thin woman with worried eyes, touched her husband's arm. Robert, please, you need help. Not from her, Robert said, his eyes never leaving Maya's face. I want a real doctor, an American doctor. Maya felt the familiar tightness in her chest, the surge of anger and hurt that she had learned to suppress over years of facing prejudice. She was American, born and raised in Chicago. She was a real doctor, with degrees from some of the best medical schools in the country. But to Robert Mitchell, none of that mattered. All he saw was her skin color. Mr. Mitchell, Maya said, her voice remaining remarkably steady. I was born in Chicago. I attended Johns Hopkins Medical School. I have been practicing emergency medicine for 8 years. I am fully qualified to treat you, and your condition may be life-threatening. Please allow me to examine you. Get out, Robert said, his breathing becoming more labored. I know my rights. I can refuse treatment from anyone I want. Get me a white doctor. A male doctor. Someone who knows what they're doing. Sandra, the triage nurse, appeared in the doorway, having heard the commotion. Her face showed a mixture of anger and sympathy. She had worked with Maya for 3 years, and knew exactly how good she was at her job. Mr. Mitchell, Sandra began. But Maya held up her hand. It's all right, Sandra, Maya said quietly. She turned back to Robert, whose face was growing paler by the second. Mr. Mitchell, you have the right to refuse treatment, but I need you to understand that your symptoms strongly suggest you're having a heart attack. Every minute we delay treatment increases your risk of permanent heart damage or death. If you truly want to wait for a different physician, I'll note that in your chart, but I'm telling you professionally that waiting could cost you your life. I'll take my chances. Robert wheezed, his hand pressed against his chest. Maya looked at Robert's wife, who had tears streaming down her face. Please, the woman begged. Please help him. I don't care what he says. He's my husband. Please save him. But legally, Maya's hands were tied. A conscious patient had the right to refuse treatment from a specific physician, even if that refusal was based on nothing but ignorant prejudice, even if that refusal might kill them. I'll page Dr. Richardson, Maya said quietly. He's currently with another patient, but I'll mark yours as urgent. She turned and walked out of the exam room, feeling the weight of every eye in the emergency department on her. News traveled fast in hospitals. Within minutes, everyone would know that a patient had refused treatment from Dr. Carter because of her race. Maya found Dr. Richardson, a white male physician in his 50s, finishing up with a patient down the hall. She briefed him quickly on Robert Mitchell's condition and the situation. Richardson's face darkened with anger. That's completely unacceptable, Richardson said. Maya, you're one of the best doctors in this department. I'll treat him, but I'm filing a formal complaint about his behavior. Just save his life, Maya replied. That's what matters. She went to the break room, needing a moment to compose herself. She had developed thick skin over the years, had learned to compartmentalize the prejudice she faced, but it never stopped hurting. Every incident reminded her that no matter how hard she worked, no matter how many lives she saved, some people would always see her skin color before they saw her skills. Maya sat down with her coffee, now cold, and took several deep breaths. She had other patients to see, other lives to save. She couldn't let one racist patient derail her entire shift. She pulled out her phone to review lab results from another case, trying to refocus her mind on medicine rather than anger. That's when the code blue alarm sounded. The overhead speaker crackled to life. Code blue, exam room 4. Code blue, exam room 4. Maya's blood turned to ice. Exam room 4. Robert Mitchell. She was on her feet and running before she even consciously made the decision to move. Her legs carried her down the hallway, her mind already shifting into the cold, focused state that emergency situations required. Personal feelings disappeared. All that mattered was saving a life. She burst through the door of exam room 4 to find chaos. Robert Mitchell had collapsed, his body convulsing on the exam table. Dr. Richardson was attempting chest compressions, but his technique was off, his positioning wrong. Richardson was a good doctor, but he was a diagnostician, not a trauma specialist. He spent most of his time reading tests and consulting on complex cases, not performing emergency interventions. Robert's wife was screaming, being held back by Sandra, as the woman tried to reach her husband. The heart monitor showed a flat line. Robert Mitchell was dying. Maya's training took over completely. Richardson, step back. I've got this. For just a moment Dr. Richardson hesitated. They both knew what would happen if Robert Mitchell survived. He would know that the black woman doctor he had rejected had saved his life. The irony was almost too perfect, but there was no time for irony, or justice, or poetic lessons. There was only a man dying on a table. Step back, Maya commanded, and Richardson moved aside. Maya positioned herself at Robert's side, placed her hands in the correct position on his chest, and began compressions. Her movements were precise, practiced, the result of thousands of hours of training and real-world experience. 30 compressions at the right depth and rhythm, then 2 breaths. Again. Sandra, charge the defibrillator to 200 joules. Maya ordered, her voice calm despite the adrenaline flooding her system. Charging, Sandra responded, her hands moving efficiently across the equipment. Maya continued compressions, counting under her breath, maintaining the perfect rhythm that might restart Robert's heart. She was aware of other staff members entering the room, a crash cart being wheeled in, medication being prepared. The emergency room had transformed into a perfectly orchestrated machine, with Maya conducting every movement. Clear, Sandra called as the defibrillator reached full charge. Maya stepped back, and Sandra placed the paddles on Robert's chest. His body jerked violently as electricity coursed through him. Everyone's eyes went to the heart monitor. Nothing. Still flat. Resume compressions, Maya said, immediately returning to her position. Her arms were beginning to ache, but she pushed through it. 30 more compressions. 2 more breaths. EPI, 1 milligram, Maya ordered, and a nurse immediately administered the epinephrine that might jumpstart Robert's cardiovascular system. Maya continued working. Her entire world narrowed to this one moment, this one patient, this one desperate attempt to pull someone back from death. She was no longer Dr. Maya Carter, the black woman who had been rejected and insulted. She was simply a physician doing what physicians do, fighting for life against death, regardless of who the patient was or what they believed. Charge again, 300 joules, Maya said after another round of compressions. Charging. Clear. Another shock. Another violent jerk of Robert's body. And this time something changed on the monitor. A blip. Then another. Then a weak but steady rhythm. We have sinus rhythm, Sandra announced, her voice filled with relief. Maya didn't stop. She checked Robert's pulse, his breathing, his pupil response. He was alive but barely. He needed to be stabilized and moved to the cardiac unit immediately. Get a bed ready in CCU, Maya ordered. I want continuous monitoring. And page cardiology. He's going to need a catheterization to check for blockages. The next 30 minutes were a blur of activity. Maya supervised Robert's stabilization and transfer to the cardiac care unit. She briefed the cardiologist on his condition and the interventions that had been performed. She filled out paperwork, documented everything that had happened, and ensured that Robert Mitchell would receive the best possible continuing care. Through all of it, Robert remained unconscious, unaware that the woman he had rejected with such venom had just saved his life. As Maya finally stepped out of the cardiac unit, exhausted and emotionally drained, she found Dr. Richardson waiting for her. That was incredible work, Maya, he said quietly. You saved his life. I did my job, Maya replied, suddenly feeling the full weight of what had just happened crashing down on her. More than your job, Richardson said. After what he said to you, after the way he treated you, you could have let me handle it. You could have stayed back and let someone else take over. But you didn't. You ran toward the emergency, not away from it. That's the mark of a true physician. Maya felt tears pricking her eyes, but she refused to let them fall. Not here. Not in the hospital where she needed to maintain her professional composure. He's going to wake up eventually, Richardson continued. He's going to find out who saved him. I wonder what he'll say then. I don't care what he says, Maya replied. And she was surprised to find that she meant it. I didn't save him for gratitude, or to teach him a lesson. I saved him because that's what I trained to do. That's what I swore to do. The Hippocratic Oath doesn't come with exceptions for racist patients. Richardson nodded slowly. You're a better person than I am. I'm not sure I could have done the same thing in your position. Maya managed a small smile. Yes, you could have. Because at the end of the day, we're doctors first. Everything else comes second. She returned to the emergency department to continue her shift. There were other patients waiting, other lives that needed saving. But word of what had happened spread quickly through the hospital. Nurses, technicians, other physicians. They all knew what Dr. Maya Carter had done, how she had faced prejudice with grace, and responded to hatred with compassion. 3 days later, Robert Mitchell regained full consciousness in the cardiac care unit. He had undergone successful surgery to place 2 stents in blocked arteries. The cardiologist had informed him that he had suffered a massive heart attack, and had technically died in the emergency room. He had been brought back to life through the skilled intervention of the emergency room staff. Robert's first question was predictable. Which doctor saved me? His wife, who had barely left his bedside since the incident, hesitated before answering. She knew what was coming, knew how her husband would react. It was Dr. Carter, she said quietly. The woman you refused treatment from. When you collapsed, she's the one who performed CPR. She's the one who shocked your heart back to life. She saved you, Robert. Robert Mitchell's face went through a series of expressions. Disbelief, denial, confusion, and finally, something that might have been shame. No, he whispered. That can't be right. She can't be the one who. She was, his wife said firmly. Years of suppressed anger finally breaking through. The doctor you insulted, the woman you called unqualified, simply because of her skin color. She's the reason you're still alive. She could have walked away. She could have let someone else handle it. But she ran toward you when you were dying, Robert. She saved your life even after you treated her with such cruelty. Robert was silent for a long time, staring at the ceiling of his hospital room. His wife watched him, wondering if this experience would change him, or if he would find a way to rationalize his prejudice, even in the face of such overwhelming evidence of his own ignorance. I want to see her, Robert finally said. I want to talk to Dr. Carter. His wife looked surprised. Are you sure? What are you going to say to her? I don't know yet, Robert admitted. But I need to say something. Dr. Maya Carter received the message that Robert Mitchell wanted to speak with her. Her first instinct was to refuse. She had no desire to subject herself to more of his hatred, to give him another opportunity to diminish her with his words. But something made her hesitate. Maybe it was curiosity. Maybe it was the hope that confronting Robert might provide some kind of closure. Or maybe, she acknowledged to herself, it was the chance to make him understand, to look him in the eye, and make him see her humanity in a way he had refused to before. Maya finished her shift and made her way to the cardiac care unit. She stood outside Robert's room for a moment, gathering her strength, preparing herself for whatever might come next. Then she pushed open the door and walked in. Robert Mitchell looked small in the hospital bed, diminished by illness and the machines that surrounded him. His skin was pale, his eyes tired, but when he saw Maya enter, those eyes widened with recognition and something else, something that might have been regret. Dr. Carter, Robert said, his voice weak. Thank you for coming. Maya stood at a professional distance from the bed, her posture straight, her expression neutral. Your nurse said you wanted to speak with me. I have a few minutes. Robert struggled to sit up slightly, wincing at the pain from his surgical incisions. His wife moved to help him, then stepped back, giving them space for this conversation that had been inevitable since the moment Maya's hands had restarted Robert's heart. I don't know how to say this, Robert began, then stopped. He looked down at his hands, at the IV lines and monitors attached to his body, evidence of his vulnerability, his mortality, his complete dependence on medical science and the people who practiced it. Maya waited silently. She wasn't going to make this easy for him. My wife told me what you did, Robert continued. How you saved my life even after He trailed off, unable or unwilling to repeat the words he had said in the emergency room. After you refused treatment from me because I'm black. Maya finished for him, her voice calm but firm. Yes, I did save your life, That's my job, Mr. Mitchell. I don't perform triage based on whether my patients are good people or whether they respect me. I treat everyone who comes through those emergency room doors, regardless of their race, their beliefs, or their opinions of me. Robert flinched at her directness, but he didn't look away. I was wrong, he said quietly. What I said to you, the way I treated you, it was wrong. The words hung in the air between them. Maya had imagined this moment. Imagined what it would feel like to hear her racist patient apologize. She had expected to feel satisfaction, vindication, perhaps even a sense of triumph, but instead, she just felt tired. Tired of having to prove her worth. Tired of facing prejudice. Tired of being seen as less than human because of something as arbitrary as skin color. Yes, Maya said simply. It was wrong. But Mr. Mitchell, I didn't save your life so you would apologize to me. I saved your life because that's what doctors do. Because I took an oath to do no harm, and to preserve life whenever possible. Your prejudice doesn't change that oath. I know, Robert said, but I need you to understand something. I need you to know that I'm not. He struggled for words, his face reddening with effort and emotion. I'm not a bad person. I was raised a certain way, taught certain things. My father, my grandfather, they had their views, and I never questioned them. I never had a reason to question them. Maya felt anger rising in her chest, hot and fierce. And you think that's an excuse? That being raised with prejudice somehow makes it acceptable. Mr. Mitchell, I was raised in a world where people like you judged me before I ever opened my mouth, where I had to work twice as hard to get half the respect, where I've had to prove my competence over and over again while white doctors with half my skills are automatically trusted. Don't talk to me about how you were raised. We're all responsible for examining our own beliefs and choosing to be better. Robert's eyes filled with tears. You're right. You're absolutely right, and I don't have an excuse. All I have is the truth, which is that I was wrong about you. Completely, utterly wrong. You're not just a good doctor, you're an exceptional doctor. And the fact that I couldn't see that because of your skin color, that says everything about my own failings and nothing about yours. Maya studied Robert's face, looking for signs of manipulation or insincerity. But all she saw was genuine remorse, the kind that comes from having your worldview shattered by undeniable reality. What do you want from me, Mr. Mitchell? Maya asked. Do you want forgiveness? Do you want me to tell you that it's okay, that we all make mistakes, that your racism is understandable because of how you were raised? No, Robert said quickly. I don't want you to make this easy for me. He paused, seeming to struggle with articulating his thoughts. I want to be different. I want to change, but I don't know how. I'm 63 years old. I've thought certain things, believed certain things, my entire life. How do I undo all of that? It was, Maya realized, a genuine question, not rhetorical, not manipulative. Robert Mitchell was asking her, the woman he had rejected and insulted, to help him become a better person. Maya pulled up a chair and sat down, finally allowing herself to relax slightly. You start by listening, she said, by actually hearing the experiences of people who don't look like you, by recognizing that your assumptions about people based on their race are not only wrong but harmful, by understanding that when you judge someone's competence or character based on their skin color, you're not just hurting them, you're limiting yourself, cutting yourself off from relationships and perspectives that could enrich your life. Robert nodded slowly, absorbing her words. Like I almost cut myself off from the person who would save my life. Exactly, Maya confirmed. Your prejudice almost killed you, Mr. Mitchell. Literally. If you had waited for a white doctor that day, you probably would have died. Your racism put your wife at risk of becoming a widow. Your beliefs nearly robbed your children, if you have them, of their father. That's not theoretical harm. That's real consequence. I have 3 kids, Robert said quietly, and 5 grandchildren. You're right. I almost left them all because I was too stubborn and ignorant to accept help from someone who didn't look like me. His wife spoke up for the first time since Maya entered the room. Dr. Carter, I want to apologize too. I should have spoken up more forcefully. I should have demanded that Robert let you treat him. I was so worried about his feelings, about not embarrassing him, that I didn't stand up for what was right. Maya looked at the woman with compassion. You were in an impossible position, and ultimately, it worked out. But yes, In the future, speaking up against prejudice, even when it comes from someone you love, is important. Silence enables hatred to continue. They sat together for a while longer, talking about race and prejudice, and the ways that unconscious bias affected everything from healthcare to education to employment. Robert asked questions, some of them clumsy or poorly worded, but all of them genuine. He wanted to understand. He wanted to be better. Before Maya left, Robert reached out and took her hand. His grip was weak, but his intent was clear. "Thank you," he said, "not just for saving my life, but for not giving up on me as a human being. You could have written me off as just another racist, but you're sitting here talking to me, trying to help me understand. That's more grace than I deserve." "Maybe," Maya said honestly, "but here's what I've learned in my years as a doctor. People are capable of change. Not always, not everyone, but some people, when confronted with undeniable truth, can choose to grow. I'm hoping you're one of those people, Mr. Mitchell." "I'm going to try," Robert promised. "I can't undo the past. I can't take back what I said or thought or believed, but I can choose to be different from this day forward." Maya stood to leave, then paused at the door. "Mr. Mitchell, can I give you some advice, please? When you leave this hospital, don't just change your mind, change your actions. Have conversations with your children and grandchildren about what happened here. Make sure the next generation doesn't inherit your prejudices. Support organizations that fight against racism. And the next time you encounter a doctor or teacher or anyone in a position of authority who happens to be black or brown, or any race other than white, check your assumptions. Ask yourself if you're judging their competence fairly, or if you're letting prejudice cloud your judgment." "I will," Robert said. "I promise I will." Maya nodded and left the room. As she walked down the hospital corridor, she felt something she hadn't expected to feel. Hope. Not the naive hope that racism would suddenly disappear, or that every prejudiced person would have a miraculous change of heart, but the grounded hope that individual people could grow, that conversations could matter, that sometimes facing our own mortality could shake us awake to truths we've been avoiding our entire lives. She also felt exhaustion. The emotional labor of educating someone about their own prejudice, of having to explain why she deserved basic respect and dignity, was draining. It wasn't her responsibility to fix Robert Mitchell's racism. She had saved his life. She had already gone above and beyond. But maybe, she thought, if her words helped him become a better person, if his transformation rippled out to affect his family and his community, then that conversation had been worth the energy it cost her. 2 weeks later, Maya was working another shift in the emergency department when a delivery arrived for her. A large bouquet of flowers with a card attached. She opened the envelope with curiosity. "Dr. Carter." The card read in neat handwriting. "I promised myself I would take action, not just change my thoughts. This is the first step. I've made a substantial donation to the National Medical Association, which supports black physicians. I've also enrolled in a workshop on confronting unconscious bias. It's not enough, and it never will be enough to make up for a lifetime of prejudice, but it's a start. Thank you for saving my life, and for not giving up on me. With deep gratitude and respect, Robert Mitchell." Maya stared at the card for a long time. It didn't erase what had happened. It didn't undo the hurt of being rejected and judged based on her race, but it was something. It was evidence that people could change, that even deeply held prejudices could be confronted and overcome. She showed the card to Sandra, who read it and smiled. "He really did it. He's actually trying to change. We'll see if it lasts," Maya said. But her tone was more hopeful than cynical. "The real test will be whether he maintains this growth, or whether it fades once he's further removed from the experience." Over the following months, Maya received periodic updates about Robert Mitchell through the hospital grapevine. He had become something of a changed man. According to his follow-up appointments with the cardiology department, he had started volunteering at a community health clinic that served predominantly minority neighborhoods. He had difficult conversations with his family about racism and prejudice. He had written letters to local newspapers about his experience and the lesson he had learned. Robert Mitchell had become, against all odds, an advocate for confronting unconscious bias in healthcare and beyond. 1 year after the incident, Maya was invited to speak at a medical conference about diversity in healthcare. As she prepared her remarks, She found herself thinking about Robert Mitchell and what had happened that day in the emergency room. She decided to tell the story. Standing in front of hundreds of healthcare professionals, Maya described the moment when a patient had refused her treatment based solely on her race. She talked about the pain and anger she had felt, the temptation to let someone else handle the case, and then she described running toward the emergency when Robert's heart stopped, making the split-second decision to save his life despite everything he had said to her. "I want to be clear," Maya told the audience. "I'm not sharing this story to paint myself as a hero or a saint. I did what any competent emergency medicine physician would do. I responded to a code blue and performed the interventions necessary to save a patient's life. But I also want to acknowledge the emotional complexity of that moment. The part of me that was hurt and angry. The part of me that wanted to walk away and let someone else deal with the consequences of his prejudice." She paused, looking out at the sea of faces. "The reason I ultimately ran toward that emergency rather than away from it is because I understood something fundamental. If I had let my anger control my actions, if I had allowed his prejudice to compromise my medical ethics, then I would have been giving racism power over me. I would have been letting his hateful beliefs determine my behavior. And I refused to do that." The audience was completely silent, hanging on her every word. "Robert Mitchell is alive today not because I'm an exceptional person," Maya continued, "but because I'm a physician who takes my oath seriously. And here's what I've learned from that experience. We cannot allow the prejudice we face to compromise our commitment to excellence. We cannot let racism determine who deserves our skills and who doesn't. Because the moment we start making those calculations, the moment we start treating patients based on whether they respect us or share our values, we've lost sight of what it means to be healers." She shared the rest of the story then. Robert's transformation, his apology, his ongoing efforts to confront his own prejudices and change his community. The response from the audience was overwhelming. Standing ovation, tears, and afterward dozens of healthcare professionals approached her to share their own stories of facing prejudice in medicine. But the most surprising response came from an unexpected source: Robert Mitchell himself. He had been in the audience, invited by the conference organizers as part of a panel on patient perspectives. After Maya's speech, he approached her, and for a moment, they simply looked at each other. These two people whose lives had become permanently intertwined by a single day in an emergency room. "Dr. Carter," Robert said, his voice thick with emotion, "I didn't know you were going to tell our story, but I'm glad you did. People need to hear it. Both the ugly parts and the hopeful parts." "Mr. Mitchell," Maya replied, genuinely surprised to see him, "I should have asked your permission before sharing your story publicly. I apologize for not thinking about your privacy." Robert shook his head. "No apology necessary. If my story, my shameful behavior, and my attempt to be better, if that can help even one person confront their own prejudices, then it's worth the embarrassment of having my ignorance exposed." They talked for a while, catching up on the year that had passed since their first encounter. Robert's health had improved dramatically. He had lost weight, changed his diet, started exercising. But more than his physical transformation, he had undergone a mental and emotional shift that he said was still ongoing. "I'm not going to pretend I've completely unlearned 63 years of prejudice in just 1 year," Robert admitted. "I still catch myself making assumptions, having biased thoughts. But now I recognize them. I question them. I actively work to change them. It's exhausting sometimes, this constant self-examination, but it's necessary." "That self-awareness is crucial," Maya agreed. "Most people never get there. They never question their own biases, never examine the unconscious prejudices that shape their perceptions. The fact that you're doing that work, that's significant." Robert hesitated, then said, "Can I ask you something personal?" "You can ask. I may not answer. Do you forgive me for what I said, how I treated you?" Maya considered the question carefully. It was something she had thought about many times over the past year. Forgiveness was complicated, especially when the hurt was rooted in systemic racism, rather than just individual rudeness. "I don't think forgiveness is really the right framework," Maya said finally. "What you said and did was part of a larger system of oppression that I face every day. Forgiving you doesn't address that system. But what I can say is this. I don't carry anger toward you specifically anymore. You're not the embodiment of racism in my mind. You're a person who held racist beliefs, recognized they were wrong, and is actively working to change. That's more than most people do. Robert nodded, understanding that this was as close to forgiveness as he was likely to receive, and perhaps more than he deserved. There's one more thing, Robert said. I've been working with a group that advocates for diversity in medical education. We're trying to create scholarship funds specifically for students from underrepresented minorities who want to pursue careers in medicine. I was wondering if you might be willing to serve on the board. Maya was taken aback. Why me? Because you're the person who showed me what I was missing, Robert said simply. Because your excellence as a physician opened my eyes to how much talent and skill we lose when we let prejudice determine who gets opportunities. Because I think your voice and perspective would be invaluable in making sure we're creating real change, not just feel-good initiatives that don't actually help anyone. Maya thought about it. More committee work, more meetings, more time spent fighting battles that shouldn't need fighting. But also, potentially the chance to make a difference, to help create a more equitable healthcare system. I'll think about it, Maya said. Send me more information about the organization. They exchanged contact information. These two people who had started as doctor and patient, moved through prejudice and life-saving intervention, and had somehow arrived at something resembling friendship, or at least mutual respect and a shared commitment to change. As Maya drove home that night after the conference, she thought about the strange journey that had brought her to this point. She thought about her 7-year-old self, watching her grandmother struggle with inadequate medical care, making a promise to become the kind of doctor that everyone deserved. She thought about all the obstacles she had overcome, all the times she had been underestimated or dismissed because of her race. And she thought about Robert Mitchell, a man who had rejected her with hatred, but who was now dedicating his retirement to fighting against the very prejudice he had once embodied. It wasn't a fairy tale ending. Racism didn't disappear because one man had a change of heart. Maya still faced microaggressions at work, still had to prove herself more than her white colleagues, still navigated a healthcare system that treated black patients differently than white patients in ways both subtle and obvious. But Robert's transformation reminded her of something important. Change was possible, not inevitable, not easy, not quick, but possible. And sometimes, the work of confronting prejudice happened not through grand political movements or sweeping policy changes, but through individual moments of crisis that forced people to examine their beliefs. 3 years after the incident, Maya was promoted to the position of Associate Director of Emergency Medicine at Mercy General Hospital. It was a leadership role that gave her influence over hiring practices, training protocols, and the culture of the department. She used that influence to implement mandatory unconscious bias training for all staff, to diversify the physician workforce, and to establish protocols that protected both patients and staff from discriminatory behavior. She also accepted Robert's invitation to join the board of the scholarship organization. The fund had grown substantially, helping dozens of minority students pursue medical careers. At board meetings, Maya would sometimes look across the table at Robert Mitchell and marvel at the unlikely partnership they had formed. One day, a young black woman approached Maya at the hospital. She was a first-year medical student doing a rotation in the emergency department. "Dr. Carter," the student said nervously, "I just wanted to introduce myself. My name is Jennifer Thompson, and I'm one of the recipients of the Mitchell Diversity Scholarship. I wanted to thank you for your work with the foundation. This scholarship made medical school possible for me." Maya smiled warmly. "How are you finding the rotation?" "It's intense," Jennifer admitted. "And I'll be honest, I've already faced some challenging situations. A patient last week asked if I was actually a medical student or if I was a nursing student. Another patient made a comment about affirmative action. It's hard sometimes, feeling like I have to constantly prove I belong here." Maya nodded with understanding. "It is hard. It shouldn't be. But it is. Can I give you some advice that helped me?" "Please, remember why you're here," Maya said. "You're not here to prove anything to people who've already decided to judge you based on your race. You're here to become an excellent physician. Focus on your patients, on learning and growing and developing your skills. The prejudice you'll face is real, and it's painful, but it doesn't define you or your capabilities. Your competence, your compassion, your commitment to healing, those are what define you as a physician." Jennifer's eyes were bright with unshed tears. "Thank you. That really helps. And Dr. Carter, I heard about what happened with Mr. Mitchell. How you saved his life even after he refused treatment from you. That story has become kind of legendary among minority medical students. It reminds us that we can't let prejudice change who we are, or compromise our ethics. Maya was surprised. She hadn't realized the story had spread so widely, or become meaningful to others facing similar challenges. I'm glad if my experience can help others. But Jennifer, I want you to know something important. You don't have to save the lives of people who hate you to prove your worth. What I did that day was my job, and it was the right thing to do. But you don't owe extra compassion or extra effort to people who don't respect you. You owe yourself the commitment to be an excellent physician. But you don't owe your oppressors anything beyond what you would give any patient. Jennifer nodded slowly, absorbing this nuance. That makes sense. I think sometimes I feel like I have to be perfect, like I have to win over every person who doubts me. But that's exhausting. It is exhausting, Maya confirmed. And it's not your responsibility to educate every prejudiced person you encounter. Save your energy for your patients and your own growth. If someone is genuinely open to learning and changing, like Robert Mitchell was, then maybe that's worth your time. But if they're just determined to hold on to their prejudice, let them. Focus on the people who see your value, and the patients who need your care. They talked for a while longer, and Maya found herself thinking about how the ripple effects of that day 3 years ago kept spreading outward in unexpected ways. Robert Mitchell had changed, which had led to the scholarship fund, which was now helping students like Jennifer pursue their dreams, which would eventually lead to a more diverse medical workforce that better served all communities. 5 years after the incident, Robert Mitchell suffered another heart attack. This time, there was no dramatic emergency room scene, no opportunity for last-minute rescues. He died peacefully in his sleep, his wife beside him, his heart simply unable to continue beating after years of strain. Maya attended his funeral. She hadn't expected to, hadn't really considered Robert a friend, despite their years of working together on the Scholarship Foundation. But when she received the invitation from his family, she felt compelled to go, to bear witness to the end of a life that had intersected with hers in such a meaningful way. The funeral was held at a small church in Robert's neighborhood. Maya was one of the few black people in attendance, a fact that didn't escape her notice. But when she walked in, Robert's wife saw her immediately and rushed over, pulling Maya into an embrace. "Thank you for coming," she said, tears streaming down her face. "Robert would have been so glad you're here. He talked about you often, you know, about how you saved his life, and then helped save his soul." "I didn't save his soul," Maya said gently. "He did that work himself. But you gave him the chance," Robert's wife insisted. "You could have let bitterness win. You could have written him off as just another racist old man. But you didn't. You saw potential for change in him that he didn't even see in himself." During the service, Robert's children spoke about their father. They talked about his final years, how he had become almost unrecognizable from the man they had known growing up, how he had started having difficult conversations about race, challenging family members when they made prejudiced comments, actively seeking out diverse perspectives and experiences. "My father wasn't perfect," his oldest son said from the pulpit. "He made mistakes, held beliefs that were wrong and harmful. But 5 years ago, something happened that changed him. A black woman doctor saved his life after he had treated her with racist contempt. And instead of just accepting that gift and moving on, my father let that experience transform him. He spent his last 5 years trying to be better, trying to make amends not just to Dr. Carter but to everyone he had wronged with his prejudice." The son looked directly at Maya. "Dr. Carter is here today, and I want to publicly thank her, not just for saving my father's life, but for giving him the grace and patience to help him become a better man. That's a gift beyond medicine." After the service, many of Robert's family members approached Maya. Some thanked her. Others apologized for their father's or grandfather's or uncle's past behavior. His youngest daughter, a woman in her 30s, spoke with particular emotion. "I need you to know what my father did meant something beyond just him," she said. "Growing up, I absorbed his prejudices without even realizing it. I made assumptions about people based on their race. I stayed silent when I heard racist comments from family or friends. But watching my father confront his own beliefs, watching him do the hard work of changing, It inspired me to examine my own biases. I'm a high school teacher now, and I work hard to create an inclusive classroom, to challenge stereotypes, to make sure all my students feel valued regardless of their background. I learned that from watching my father's transformation. Maya felt tears in her own eyes now. This was the ripple effect she hadn't fully understood before. Robert's change hadn't just affected him. It had influenced his children, his grandchildren, his community. One person's willingness to confront their prejudice had created waves of change that extended far beyond that initial moment in an emergency room. At the reception after the funeral, Maya found herself in conversation with Robert's wife, who wanted to share something. "Robert left you something in his will," she said. "A letter. He wrote it about a year ago, when his health started declining, and he knew he didn't have much time left. He wanted to make sure you received it." She handed Maya a sealed envelope with her name written in Robert's now familiar handwriting. Maya opened it carefully and began to read. "Dear Dr. Carter," the letter began. "If you're reading this, I've passed away, and I'm hoping it was peacefully in my sleep rather than another dramatic emergency room scene. I wanted to write to you one last time to say things I may not have expressed clearly while I was alive. You saved my life twice. The first time was obvious, when my heart stopped and you brought me back. The second time was less dramatic but perhaps more important. You saved me from living the rest of my life as a prisoner to prejudice and ignorance. You showed me what I was missing, who I was hurting, and how much richer life could be when I opened my mind and heart to people I had spent my entire life dismissing. I know I can never fully make up for the harm I caused, both to you personally and to countless others through my years of carrying and spreading racist beliefs. But I want you to know that the last 5 years of my life were the best years, not because of my health, which has been declining, but because I finally felt like I was living according to values I could be proud of. The scholarship fund will continue after my death. I've made sure of that through my estate planning. I hope it helps create a medical profession that looks more like the diverse world we actually live in rather than the narrow world I grew up believing was the only one that mattered. Thank you, Dr. Carter. Thank you for your skill as a physician, for your grace as a human being, and for your willingness to see potential for change even in someone who didn't deserve your compassion. I hope you continue to inspire medical students and challenge systems and save lives, both literally and figuratively. With profound gratitude and respect, Robert Mitchell. Maya folded the letter carefully, her vision blurred with tears. She had spent so much of her career fighting against prejudice, proving her worth, overcoming obstacles that her white colleagues never faced. This letter didn't erase those struggles or make them worthwhile. Nothing could do that. But it was a reminder that sometimes, in rare moments, the work of confronting racism actually succeeded in changing someone's heart and mind. 10 years after that day in the emergency room, Dr. Maya Carter stood before a new group of medical students beginning their clinical rotations. She had been asked to give a talk about professionalism and ethics in medicine, and she had decided to tell them the story of Robert Mitchell. She described the moment of being rejected by a patient because of her race. She talked about the anger and hurt she felt. She described running toward the code blue, performing CPR, making the split-second decisions that saved Robert's life. And then she shared the rest of the story, Robert's transformation, their unlikely partnership, and the ripple effects that extended far beyond one emergency room encounter. I tell you this story not to suggest that it's your job to educate every prejudiced person you encounter, Maya said to the students. It's not. You don't owe your oppressors anything beyond what you would give any patient. But I want you to understand something important about being a physician. Our job is to heal, even when it's hard, even when the patient doesn't deserve our compassion, even when everything in us wants to walk away. She paused, looking out at the diverse faces in the audience. Students of all races, genders, backgrounds. The medical profession was slowly changing, becoming more representative of the communities it served. Here's what I've learned, Maya continued. The moment I let prejudice determine my actions, the moment I let someone else's racism compromise my commitment to healing, I give that prejudice power over me. I become something less than the physician I trained to be. So when I ran toward Robert Mitchell's code blue, I wasn't being a hero or a saint. I was being a doctor. I was refusing to let his hatred determine my behavior. One student raised her hand. Dr. Carter, do you think Robert Mitchell truly changed, or was it just guilt and gratitude? It was a good question, one Maya had asked herself many times over the years. I think it started as guilt and gratitude, Maya answered honestly, but I believe it became something deeper. I watched him do the work of examining his beliefs, having difficult conversations, changing his behavior. That's not easy work, especially for someone in their 60s who has held certain beliefs their entire life. Was his transformation perfect? No. Did he still sometimes fall back into old patterns of thinking? Yes, but he kept trying, kept learning, kept growing. That's all any of us can do. Another student spoke up, this one a young black man. But Dr. Carter, why should we have to save people who hate us? Why is it our responsibility to show them compassion when they show us none? Maya smiled, recognizing herself in that question, in that anger, in that completely justified frustration. It's not your responsibility, Maya said firmly. Let me be very clear about that. You don't owe extra compassion or extra effort to people who are prejudiced against you. What I did with Robert Mitchell, having those conversations helping him change, that was my choice, and it was exhausting. It cost me emotional energy that I didn't necessarily owe him. You have every right to save a life and walk away. You have every right to be an excellent physician without also being a teacher of anti-racism to every bigot you encounter. She let that sink in before continuing. But here's what I also want you to understand. When you refuse to let prejudice compromise your commitment to healing, you're not doing it for them. You're doing it for yourself. You're refusing to give racism power over who you are as a physician. You're choosing to be defined by your values and your skills, rather than by how others treat you. That's not about being noble or forgiving. That's about maintaining your own integrity in the face of hatred. The students nodded, processing this nuance. Medicine was complicated. Ethics were complicated, and navigating prejudice while maintaining professional standards was perhaps most complicated of all. After the talk, several students approached Maya with their own stories of facing discrimination in medical school and clinical settings. She listened to each one, offered advice when she could, and reminded them that they were not alone, that the struggle they faced was real but not insurmountable, that they had chosen one of the most noble professions, and their presence in medicine was making it better for everyone. As Maya walked back to her office that day, she passed through the emergency department where it had all started 10 years ago. Exam room 4 was occupied, a team of doctors and nurses working efficiently to treat a patient. The emergency department had changed over the decade, new equipment, new staff, new protocols, but the essential mission remained the same: saving lives, healing the sick, responding to emergencies without prejudice or preference. Maya thought about Robert Mitchell, dead now for 5 years, but still influencing the world through the scholarship fund he had established, and the people he had changed through his transformation. She thought about all the students who had been helped by that fund, the future physicians who would go on to treat patients with the same commitment to excellence and compassion that Maya had modeled. And she thought about Jennifer Thompson, that first-year medical student she had spoken with years ago, who was now a resident in pediatric medicine, already making a difference in the lives of children and families. She thought about Robert's daughter, the high school teacher, shaping young minds to be more inclusive and aware. She thought about all the ripples spreading outward from one moment of crisis, one choice to heal rather than harm, one life saved that had somehow led to so many others being changed for the better. Maya had spent her career fighting against systems of oppression and prejudice in medicine. She'd experienced discrimination, microaggressions, and outright racism more times than she could count. The story of Robert Mitchell was just one incident among many, and his transformation was far from typical. Most people who held racist beliefs never confronted them, never changed, never did the difficult work of becoming better. But Robert's story mattered because it proved that change was possible, not inevitable, not easy, not guaranteed, but possible. And in a world where racial prejudice often felt like an immovable force, where progress seemed painfully slow, that possibility mattered. Dear viewers, sometimes the hardest thing we can do is extend compassion to those who don't deserve it. Dr. Maya Carter faced an impossible choice when the patient who had rejected her because of her race was dying in front of her. She could have walked away, let someone else handle it, protected herself from further emotional harm. No one would have blamed her, but she chose differently. She chose to be the physician she had trained to be, to uphold the oath she had taken, to save a life regardless of whether that life appreciated hers. This story isn't about a black woman doctor proving herself to a racist patient. It's not about earning respect through exceptional skill, though Maya certainly had that. It's about something deeper and more important. It's about refusing to let prejudice determine who we are and how we act. It's about maintaining our integrity and our values even when, especially when, others fail to see our humanity. Robert Mitchell's transformation was remarkable, but it's not the most important part of this story. The most important part is Maya's choice in that moment, when his heart stopped beating. The choice to run toward the emergency, rather than away from it. The choice to be defined by her commitment to healing, rather than by someone else's hatred. The choice to refuse to give racism power over her actions. That choice echoed through the years that followed. It influenced Robert's family, inspired medical students, created scholarship opportunities for future physicians, and reminded everyone who heard the story that we are defined not by how others treat us, but by how we choose to respond. Maya Carter saved a life that day. But more importantly, she saved herself from becoming someone she didn't want to be. Someone who let anger and hurt compromise her values. Someone who gave prejudice the power to change who she was as a physician, and as a person. In the end, that's the lesson this story teaches us. We can't control how others see us, how they judge us, what prejudices they hold. But we can control who we choose to be in response. We can choose compassion over bitterness. We can choose integrity over revenge. We can choose to uphold our values even when others fail to recognize our worth. Dr. Maya Carter chose to be a healer, even when it meant healing someone who had tried to deny her humanity. And that choice, made in a moment of crisis 10 years ago, continues to ripple outward, changing lives, inspiring others, and proving that sometimes the most powerful response to hatred is simply refusing to let it change who you are.